threw her phone into a fire pit one time. So the next day he tried to act like it never happened and he bought her a new phone. So yeah, we see that a lot in our book, and it's like, it's really sad.
It is really sad. And most of the times, folks who have PTSD are really embarrassed by their behavior. They're aware that they're really angry or that they respond in ways that other people don't. It's clear to them. That's usually why they withdraw and isolate, because they know that they're responding differently and it's not very comfortable to them.
Okay, so, did you have any first questions?
Yeah. What would you do to help Andy and Haley in our book? What advice would you give them?
Well, the very best treatment for a family or for a set of individuals would be to put them in group settings with other people who have had similar experiences, because it's more likely for them to speak again if there's other people around who they think understand or notice. In that particular situation, family therapy would be appropriate, to have everybody in the household in therapy together with one therapist. And so those would be a couple of different ways. In the military, they've got military folks who come in who are mental health providers who will address just PTSD symptoms with war vets. And so what really needs to happen is that happens more and more frequently than it does. That would help alleviate a lot of this, actually.
Okay. Ethan?
She kind of really already answered my question.
Yeah,
What was your question
It was,
out of curiosity?
Have you ever seen and worked with men like Andy before in our book?
Yes, and lived with them. So, my father was not only like that, but I watched people that he used to hang around, his friends, also do those kinds of things. And I have seen war vets and recent war vets who have very difficult time functioning. The one that comes to mind is this very, very physically strong young man that came in, and he was in his early 20s. And so, boy, if you needed somebody to protect you, he'd be exactly the fella. But as strong as he was physically, he was not strong emotionally because he had PTSD. And so he would have a very difficult time in social situations and crowds. And what brought him in for treatment was actually that he was having a hard time in his marriage because his wife could not handle the symptoms he was experiencing. They'd be out at a ball game or they'd be doing something social, and he would lose his temper and he would become angry and frustrated, and they would have to leave a situation so he didn't fight with somebody or so he didn't act out and they caused a scene. And so his wife ultimately gave him an ultimatum and said, if you don't seek treatment, we can't stay together. And so a lot of times what you will see is if they have interpersonal relationships, girlfriends, wives, families, the family members will encourage them to get help because the symptoms affect everybody in the household. And it's very difficult to live with somebody who quickly angers, becomes frustrated, doesn't sleep well, you know, those kinds of things.
Yeah, so like in her book, Haley, she reacts about like her dad with PTSD by like ignoring schoolwork, trying to push that away. She pushes away her memories, sometimes her friends, and even her boyfriend. So like, you said you work with children and teenagers. Is this also common for their symptoms?
Yes, absolutely. And so I will watch them withdraw and isolate. So where they might be doing something normal, like somebody might have a sleepover, for instance, it was just Halloween, so they'd go in groups to trick or treat. Folks, especially little ones who have PTSD, they don't necessarily like to do those activities, so you won't see them doing things that their peers might be doing. They tend to be by themselves. When they do have friendships, it usually tends to be one or two select people that they trust or talk to. And they withdraw. They become what we refer to psychologically as flat. So they look like they have no emotional response because they try to distance themselves from things. And so those are things that are common. So for instance, one of the young ladies that I was speaking to yesterday, these were her sentences or words. She would say, I can't even cry. I want to cry, but I can't. And so that's very typical.
Okay. So like, this isn't a question, but the sad thing about this book is that, so Haley traveled around with her dad, like, at a very young age until she was about like 16, senior in high school, in the truck. So like, I know it's good that they had that bonding time, but the sad thing is that he isolated himself from the world, but he had to isolate her too, because they didn't know what to do with her. So she never really had that chance to get social with anyone. She was just taken away from it by her dad.
You're making a really great point, and again, given that I had that experience personally, we would move on average every 2 years. And so you would have to make friends all over again, you'd have to get to know new environments or figure out your way around. And there can be some great things that happen from that, like I'm pretty versatile and can accommodate no matter where I'm at or what I'm doing. But it also means that it's pretty hard to connect with people, because you know you're not gonna be there very long.
Yeah.
And so it takes a special skill set to do that.
Okay.
It also makes school pretty hard, because if you move from one school to the next every couple of years, not all schools do things the same.
Yeah.
So sometimes you might repeat work you've already done, or sometimes you'll be exposed to work that you hadn't seen before, so it makes it really difficult academically. That might be another reason why she maybe distanced herself and kind of let the schoolwork go.
Yeah, and the other reason is she was homeschooled with her dad. She never went to school since like kindergarten, and then she came back
Wow.
in senior year, high school.
She's,
It was
in the book,
extremely
she's going on
difficult.
18. I don't know if she was at the end.
Yeah.
Wow. Holy cow.
Yeah, it was really difficult for her, and she hadn't had a driver's license or anything. So
Nothing
she was,
normative.
It seemed like she was just like that awkward person at school, and she felt like everyone was like, she labeled people like, you know, like
the zombies.
zombie or
Cause she, like, the zombies in her turn is like people who are like, I hate to say, but like fake, you know?
do everything that someone else is doing.
Yeah.
Like the weird kids.
Yeah,
They
like
follow the crowd.
Say it again.
They follow the
Yeah.
crowd. Like
they follow the
zombies.
crowd. And the freaks are the people with like they're weirdos. They're cool, you know, like they don't follow the crowd, they do their own thing. And that's what she considers herself, isn't it?
Something,
Yeah.
That's a pretty cool expression, actually. That makes a lot of sense.
Yeah.
Folks who have PTSD or folks who have experienced vicarious trauma, a lot of times they just don't think anybody will get them, and that's part of the reason they pull away. So
Yeah.
can you imagine not ever having gone to school and then you go your senior year? Everything would be weird, all the way down to the desks and computers and bathroom. Oh my gosh.
Yeah. But I think it'd be more difficult. She didn't really like, I wouldn't say that she could fit in, but she wasn't really noticed. So it wasn't as difficult as I think it would be.
Like she made friends pretty much.
Yeah,
right
she
away.
only had 3 though, but she still made friends pretty fast.
What you guys are describing is really interesting, and here's something from a mental health perspective. Sometimes how people feel or experiencing something themselves is not how somebody else perceives them. And so somebody who has PTSD or has experienced a trauma think that they might be weird or different, or they're worried that somebody will see them strangely, and other people around them may not even notice and think that they're perfectly normal. And so how a person feels versus how somebody else sees them sometimes are two very different things.
Yeah. So,
Quick question.
Sure.
Is there any way that like it's not necessarily like a very violent way of, well, I gotta rephrase this. People normally just see like PTSD as like something violent happening. Is there any way like it can't be violent but it still happens?
Yes. So a perfect example of that would be like a medical procedure. So sometimes folks who have a medical procedure or they have something happen to them in the hospital or a surgery, that can be traumatizing to them because it's scary, uncomfortable, and they can experience that as a trauma, whereas somebody else could have the same experience and not see that as traumatizing at all. So no, a death doesn't have to occur.
so like, the sad thing is that Andy never got help, like ever. Like I don't never went to
He
the other side.
refused it.
He had so many triggers. Like when he went to war, they bombed the wrong house, and who did they bomb? They killed.
Like
They
kids.
killed
They
it
killed
was their
children and
families.
families and like what did they say? Old people or something like that.
The
Like this
elderly.
huge family.
Yeah.
Like little kids up to like old.
And then his best friend Roy died in the army. His wife died. His mom died. His yeah. Yeah, he died, and that's when he flipped out and teared the whole house up. And then his daughter has school problems, and his old girlfriend left, and now she's back. So he's like so many triggers, and he hasn't gotten help since he's been on the road. And how long has he been on the road, like driving?
They were, well, I think Haley said she went to kindergarten
Yeah, and
at that
they went
school,
on the
and then they
road.
went on the road from when she was like first grade up to like
18.
junior year.
Yeah.
Like, right.
Yeah, so like how long would it take, or is it even possible to help him?
Well, somebody who has experienced PTSD for that long a period of time, if they came in for treatment years later, chances are they're not going to get the symptoms to go away completely. They're just going to manage the symptoms they have so they can become more functional, they can become more healthy, they can have a bigger awareness of how it affects other people around them. They can learn to communicate differently, so you can still certainly treat it, but it's been my experience that folks who have waited a period of time to come in, one of the things that's the most common is, for the most part, the nightmares will subside and the difficulty sleeping will subside, and then all of a sudden they'll have one of those nights where they have nightmares and sleeplessness, and it's very difficult for them because they get so excited because they've gone so long without having it that when it occurs again, it's really big because they're like, oh, I thought this went away. So it's more about managing it when they happen. They just happen less frequently.
Yeah. And one of the other things is suicide in this book. Like the quarry, it's known for like
It's like the most suicidal
yeah.
spot.
Drunk teenagers.
Yeah, and they just go suicide. So like in the middle of the book, Haley remembers her dad getting cramps in the water, and he was kind of drowning, but they saved him in the end. And she talks to her stepmom, and her stepmom says the weird thing is that he said that it was almost peaceful, and that would be the way that he wanted to go. So like when they're looking for him and trying to find out where he is because he disappears, she knows he's at the quarry to go suicide. And when he gets there, like he's sitting there and she talks him out of it, and then like she falls and he saves her, and all that happens. So in trauma, how common is suicide, and have you ever seen it before?
Yes. So the easiest way to explain it from a person's point of view who is experiencing it, it's like torture. It's like being exposed to trauma repeatedly all the time. Whether it's your nightmares, whether it's how you see the world, they're constantly in pain and uncomfortable, and they would do anything to get rid of that. It's why you see drug use, it's why you see them with alcohol-related issues, because they want those feelings to go away so badly and just be numb for a while. And so the possibility of thinking about something like, oh, I'll actually have some peace, this torment will not be there, that's usually what you're describing in terms of, I felt peace for the first time. I didn't have this torment, I didn't have these thoughts, I didn't have this constant fear. That's all they want, is a break from it, for it to go away. That's one of the things with PTSD, it's just constant, all the time, every day you're struggling with things. So they just would like to have one good day where it doesn't feel like that. And it's not uncommon for folks to take their lives when they're experiencing that kind of trauma all of the time.
What time is it?
10:28.
We got like
2
about
minutes.
5 minutes left, and then we
Yeah,
should
we are.
probably head back up.
Yeah, we were literally out of questions. So.
I still have my question.
Oh yeah.
What would be like a situation you'd give up on a patient?
I don't think I've ever given up on a patient for any reason.
What would it be?
What was it? What was the last one?
It's a good question.